Hello, I'm Tina Jennings. Now, of course, we know to get our teeth cleaned twice a year, go in when you have a toothache, but do you know what are some of the common signs you need orthodontic treatment? Dr. Kurt Kacer with Ortho Pros does, and he's going to share that with us today.
Yes.
I was kind of saying we're going to do kind of like an overview of when you should know and the do's and don'ts kind of.
Yeah.
So let's start with those common signs or common things we would come and see an orthodontic for.
Yeah. A lot of times most people start because there's just misalignment of the teeth.
Yeah.
So from an aesthetic point of view, they want alignment, they want that nice confident smile. But then there's also issues with your bite that you want corrected as well too. So sometimes people will have either a smaller lower jaw or a smaller upper jaw as well. And so moving teeth around can get you to the bite that's healthy for you as well too.
And just before we got on, I said, I think there's a myth that people think that you have to go to your dentist first and then your dentist will kind of let you know if you need to go see an orthodontist. That's really not the case. If you think you need this, you can go directly in.
Yes, yeah, and that's how most people actually, especially recently, have been coming into the office as well. So you don't need a referral from your dentist. Anybody can, basically the orthodontist will tell you whether you're a candidate or you need treatment or the benefits of treatment as well. But yeah, traditionally there's always been a referral from the dentist, but it's not necessary. And so people have kind of waited on that, whereas now word's getting out more and you're getting a lot more people that are just calling in and saying, like, we do a free consultation, exam, and x-rays, and so they'll call in and we say, yeah, come on in, we'll take a look, and you don't need a referral from the dentist.
So you can find out straight from the horse's mouth whether or not this is going to be a good fit for you.
Yes.
So maybe what are some of the benefits that we could gain so that we know if maybe this is the right route?
Yeah, a lot of times, if you're looking at teenagers, it's almost kind of a rite of passage at this point. You want that smile, you want things looking nice. A lot of times people have problems with teeth erupting, and so from a teenager standpoint, those are a lot of issues where we end up in braces or Invisalign. From an adult standpoint, it's typically more health reasons. Fixing the bite, being able to, teeth that are crowded on the lower, being able to clean them easier, maintain them longer when you get them straight and aligned. So adults tend to focus more on the health benefits of it, whereas teenagers, it's more impactions or just getting that smile that they want.
Which I was one of those. I was one of those children that went through that.
Yes.
Now, if we're a parent and our kids are kind of going through, like you said, that rite of passage and everything, what should we be keeping an eye out for when our children are going from baby teeth to permanent teeth, and as they kind of go from that point?
Yeah. So we actually recommend that children come in at around 7 to 8 years old, and it's really, the guide is more of those 4 front teeth that are coming in on the top and the bottom. So that's when we first want to see them for an exam. Now our other guide is that we really don't want to treat if we don't have to until all the baby teeth out and the permanent teeth are in.
Okay.
But by seeing them early, we can identify issues that are better corrected earlier. So for example, in our practice, of the kids that we see from 7 to 8 years old till about 11 to 12, we treat less than 5% of those kids, because we don't want to do a lot of early treatment, but there are some situations where it's necessary and it's very beneficial. But most of the time we can at least monitor their growth and development, and we do those free exams and consultations over a period of years until they're ready for braces.
I think that age that you just said might actually surprise some parents, that 6 to 7, because like you said, that's the formative where we need to kind of get in and see where we're going. And we were looking at all those different things that are the common treatments that you guys would handle. So if, let's find out that is me, whether I'm an adult, I'm a teenager, or I'm that 6 or 7-year-old that needs to come in, how do I decide who is the right orthodontist for me? What should I be looking for?
I think just the presence that they have in the office, right, and how comfortable you feel with them as well too. So, for us, we're hoping to convey kind of our message and the warmth of our office, even on the initial phone call that people call in for. And so most people kind of get an idea just from that, phone call and the website, and getting an idea of kind of what practice that they're looking for, and then coming in and actually meeting everybody is, a chance to get a feel for the office.
Well, I don't know about anybody else, but that's important to me. Of course, the customer service, how,
Yes.
you know, you want to love everybody that you're going into when you're talking about your health and maybe something you're not really sure of, or, you know, we can be a little scared when we hear those words, but that's a great thing to be thinking about. And I do love that you said that you guys do those free consultations. So when somebody comes in and they're not sure, is that kind of that point of reference? We can see what treatment's going to be best, because there's a lot of options.
Yeah, exactly. And that's what we want to do, is just be able to say, okay, let's take an x-ray, let's take some photos, let's see what you have, and then we can talk about if treatment's even necessary or not, or even identifying what are your goals, what are you trying to accomplish with this as well too, which for us is actually the biggest thing, right? Identifying what the patient's looking for, what the patient's needs are, and then essentially have a conversation at that point about here's your options for that.
Because we want to know that it's a personal treatment for me and what's best for me. And I know we were talking everything from Invisalign. We know you guys are well known for the A braces.
Yes.
You know, you guys have so many options that are out there that I think a lot of people don't even know are an option.
Yeah. And Invisalign's actually a really big, braces as opposed to Invisalign. Invisalign's really taken off, and we've done a lot of Invisalign, and we treat a lot of patients with Invisalign. And we've gotten very good feedback from that. So a lot of people refer because they didn't know that Invisalign was necessarily an option. And the more that you do, the more comfortable you become with it, the more experienced you become. So that's where we're at now, of being able to treat a lot of cases that some people thought maybe they weren't a candidate for. And especially as adults, that's really most. I had my braces when I was 30, and I had braces and I was going through dental school. So Invisalign to me is a wonderful option at this point.
Well, you never know until you come in and find out. So, Doctor, I'm going to tell them again how they can get a hold of you for that free consultation. And I know you guys have a special that you're running. I'm going to tell them as well. But thank you so much for coming in.
Thank you.
You guys, Ortho Pros offers free consultations and braces for the incredible price of $99 per month. To make your appointment, call 290-8787. And for more information, log on to orthoprostucson.com.